everybody. My name is Shirley Pavlik. I'm a nurse practitioner. My specialty is women's health nurse. I've been doing that for many years. And I'm also public health nurse. So I work in the community teaching fertility awareness for many years, for over 20 years. And now I have my clinics and giving the service of, along with teaching fertility awareness, fitting barrier methods for women, which includes diaphragm fitting, cervical cap fitting. And I want to share with you a little bit about my work and my clinic. Hopefully it will evoke ideas to encourage healthcare professionals around you and near you to get trained in also as fertility awareness educators, but also as trained fitters for diaphragms and cervical caps, because at the moment it's quite challenging to get proper fitting by a healthcare professional. To offer proper fitting, I merged it into my clinic so I could offer a complete service. And a complete service in my concept is teaching fertility awareness for whatever purpose, just observing your body, healthy functions, or detecting imbalances and get proper treatment, or using the method for trying to avoid pregnancy, or using it to try to achieve pregnancy. I only teach one-on-one, and I go with my clients hand in hand for at least 12 cycles, especially for those who want to use fertility awareness as trying to avoid pregnancy. So it takes a little bit time to be sure that the woman really is perfectly knowing the rules and what she's doing, and so we can say, okay, that's it, we can separate, but I'm always in the background, for any questions and everything. And along with the learning fertility awareness and slowly starting to merge it to the woman's daily life, I always encourage her to use some kind of contraception if she's not sure what her status is, whether she's in her fertile window or not. If she's doubting anything, she should use some sort of contraception method. And of course, for those of us who are choosing to have intercourse or sexual relationship, which includes intercourse within the fertile phase, it is highly recommended, if we want to avoid pregnancy, to use some kind of effective contraceptive method. And using diaphragm or cervical cap combined with spermicide is definitely a successful option, a good option. So before I show you the options we have, I want to say that using cervical caps and diaphragms goes along perfectly with using fertility awareness. Of course, all my clients are familiar. Some of them choose to use the Tempdrop as a supportive device for fertility awareness if they want to use this method to avoid pregnancy. Naturally, it's a perfect recommended device if you want just to observe your cycle or you want to achieve pregnancy. So for those of us who want to use the method to avoid pregnancy or to delay pregnancy, it is always recommended to use some kind of contraceptive method if you're not sure or you're still studying the method. And I want to show you some of the devices we have. So these are some of the diaphragms we have, modern diaphragms, okay? And we also have cervical caps. Altogether in the clinic, I have like maybe 20 options. Each diaphragm has sizes. Most of the models of diaphragms have sizes, and cervical caps have also sizes. So we, in a fitting appointment, we choose the right device for the women, and a significant amount of time in the fitting appointment is dedicated so the woman can practice under my supervision how to put the device correctly, how to check that she puts it correctly, how to take it out. And the purpose is that after the meeting ends, she has the right device, she knows how to use it, she knows all the rules, how to achieve maximum effectiveness using the diaphragm or the cervical cap. It's important to mention that for those of us who are using or are familiar with fertility awareness method, using a feminine barrier method such as diaphragm or cervical cap is almost natural choice because we know the cervix. This is part of the lifestyle we chose. Getting familiar with the cervix is a basic stage in learning or getting familiar with fertility awareness. And for those of us who are familiar with the cervix, it's only natural to engage with a device such as a diaphragm or cervical cap because those devices are meant to cover the cervix. And it's so natural for us to put the device in our body and to check whether the cervix is covered without hesitation, without fear. This is such an advantage comparing to those women who are not familiar with the cervix, who are not familiar with their body. And it's so much easier for those of us who use fertility awareness to use those devices. I'm going to show you how does it actually work. Okay, so this is our front part, this is our back part, and we have here our cervix. This is the opening of the vagina. Okay, this is our bladder. Okay, and our uterus is actually leaning against our bladder. And what we want to do is actually insert the diaphragm through the opening so the cervix is covered. So if I'm taking this diaphragm, for example, this is a Kaya. Kaya diaphragm is marketed as one size fits all. I can tell you from my long time experience and thousands of fittings, it fits some women, not every woman. So we need to check whether the kaya fits us or not. And actually, what we do is we fold the diaphragm. Okay, I need to do it a little bit backwards. Okay. And we insert it, and the diaphragm actually leans like that. Okay. So the cervix is actually behind this soft membrane of the diaphragm. So when we have intercourse like this, okay, let's say this is the direction of intercourse, there isn't a direct exposed contact where the sperm is ejaculated and the entrance of or the opening of the cervix. We need to leave the diaphragm in place for at least 6 hours after the intercourse. And then we can actually pull it out simply like that. We always use the diaphragm in combination with spermicide. So we use the diaphragm with the spermicide, and I recommend using natural-based spermicide, which is a physiological spermicide. It is based on lactic acid. I think in the US you have Fexi. In Europe, we have Kaya or Contragel, which are actually the same product. And we put the spermicide or the diaphragm gel inside the diaphragm right here. This is where the cervix is leaning. So this is where we want the gel to be. So in general, this is very simple mechanism of action. The spermicide works on the principle of lactic acid. As we all know, sperm doesn't like acidic environment. Sperm flourishes in alkaline environment. So we manage to have acidic environment around the cervix with the diaphragm. So we have a few mechanism of actions as far as the barrier itself, whether it's this diaphragm or that diaphragm or kaya or cervical cap, doesn't matter, whatever fits that woman. And we have the impact of the spermicide as well. So we have a few mechanisms of action. Altogether, if we keep 5 simple rules, first is having the right device. Then we need to make sure that we use it every time. For those of us who are using fertility awareness and are 100% sure fertility window is over or not yet open, so we use it every time, only if we are 100% sure where we are around the cycle as fertility awareness users. What we need to make sure is that we always use it with the spermicide. We have to make sure that the diaphragm is covering the cervix after we insert it, and we check it again before we take it out as well. So if we keep these rules, and one last rule is that we wait for 6 hours after, at least 6 hours after the intercourse. The diaphragm can stay in place for up to 24 hours, or cervical cap can stay in place up to 48 hours. I don't recommend reaching those extreme time frames, but not less than 6 hours in place after intercourse. All these rules together bring us to effectiveness of 98% in preventing pregnancy, which is very effective. And it is not interfering with our physiological hormonal cycle, has hardly or none side effects at all. So it's a quite interesting and preferable option for many women. What we also have is we have an inserter. For some women who find it difficult to insert the diaphragm, they can use this inserter, just putting the diaphragm on the inserter and helping them reach the right spot using the inserter and then releasing the diaphragm in place. So that's also an option. All these options are being figured out in the fitting appointment. When you choose a healthcare professional to fit you with a cervical cap or a diaphragm, first of all, you have to make sure that this practitioner is trained to do that fitting procedure. Second of all, you can ask what's her experience, how many fittings she does every week, how experienced she is. And it's needless to say that as more experienced she is, the better. The next thing, you want to know that she has all the equipment in her clinic. As I said, we have almost 20 options as far as models and sizes. You want her to be well equipped. Another thing is to ask what the fitting appointment includes. Using a diaphragm is not just giving you a device which was fitted by the healthcare professional and send you off to go at home to figure it out by yourself, how to use it. That's not a proper fitting. A proper fitting would be having the relaxed and proper time frame of about an hour, giving you the relaxed setting and time frame, not just to be fitted, but also to practice self-insertion of the device, checking whether the cervix is covered, that you properly place the device, taking it out, and having enough time to practice it on your own in the clinic under the supervision of the healthcare provider. You need this support. It's not like swallowing a pill or putting a patch. It's a little bit similar to learning fertility awareness. You need someone to go along with you to make sure you reach a phase that you are 100% comfortable with the technique of using the device. That will ensure that you are on the higher level of using the device with maximum effectiveness. So these are basic guidelines of getting proper fitting. I trained midwives and healthcare professionals in the States to do proper fitting, and you can contact me for guidance of how to find those healthcare professionals, mostly midwives. And really don't be alone with it. I encourage you to approach a skilled and trained healthcare professional to get proper fitting and to be supported by a skilled healthcare professional. One more thing I wanted to add about using the diaphragm, and that's lubrication. In my clinic, I use lubrication, which is based on hyaluronic acid, which is rehabilitating and nourishing the membrane of the vagina. And with the diaphragm, as opposed for condoms, for example, we can also use oils, natural oils for lubrication. Naturally, we can use water-based lubrication, but we will not use silicone-based lubrication because it interacts with the silicone which the diaphragm or the cervical cap is made from. So lubrication is extremely important, especially for women who are using diaphragms or caps and are postpartum breastfeeding with low levels of estrogen, which can cause a relatively dry environment, or women who are on their perimenopause, who can also experience relatively dryness sensation due to the declining levels of estrogen. So I encourage you to use some kind of lubrication if you feel the need for it. The insertion and the taking out of the diaphragm should not be causing any discomfort or pain. One of the signs that the diaphragm is maybe not placed properly or not fitting in size is that you feel discomfort or pain while the diaphragm is in. It should not be really felt at one hand, and it should be properly covering the cervix and staying in place. There might be slight movement, but not sliding out of the vagina or, moving in a way that the cervix can be exposed. So I think we covered everything. If there are questions, you are welcome to contact me. You're welcome to ask me any question regarding the subject. Thank you.